Hello one and all. Today we're going to discuss about the biomechanics of knee joint, especially the patellofemoral joint. So coming to the biomechanics of patellofemoral joint, it comprises of articular components, patellofemoral motion, the forces around the patella, and pathomechanics. So what is patella? Patella is nothing but the largest sesamoid bone in the body. It is triangular shaped bone embedded with the quadriceps tendon, primarily acts as an anatomical pulley for quadriceps muscle. So this is nothing but the articular surface of patella. This is the femoral groove, and this is the patella, and this is the joint surface in which the patella holds on the femur. And yeah, this is the medial aspect, and this is the lateral aspect. This is the vertical ridge, and this is the odd facet. Yeah, here comes the rotation of patella. This is the medial patella rotation, and this is nothing but the lateral rotation of patella. This is nothing but patella tilt and shift to the either side, that is lateral and medial. Yeah, here comes the patella flexion and extension. Yeah, this is the picture representation of superior, inferior, medial and lateral aspect of the patella. That is during the tilt, rotation and shift. Yeah, this is a very simple picture representation in which during the flexion of patella, the area comes which in contact with the femur is nothing but during, for example, simply saying during 10 degree of flexion, this area of patella comes under the contact with femur, and during 45 degree of flexion, this area of patella comes in contact with the femur, and during 60 degree, 90 degree, and during 115 degree, this is the area of patella that is in contact with the femur. Yeah. What is the stability of patella? One of the most incongruent joints in the body. The stability also depends upon the static structure, dynamic structure, length of patellar tendon, and the lateral lip of femoral condyle. These are the forces that is acting on patella. So these are the laterally directed force, and these are the medially directed forces. So the first one is vastus medialis muscle. The second one is medial patellar retinacular fibers. On the lateral side, it is lateral patellar retinacular fibers, bow-stringing forces on the patella, and the other one is iliotibial band. Yeah, this is nothing but the forces in and around the patella during activities. So during walking, the patellofemoral joint force is about 3.3 times of the body weight. During ascending or descending stairs, it is about 0.5 times of the body weight. And during activities of 5 degrees of flexion, it is about 30 degree of body weight. And during 30 degree of flexion, it is about 2 times the body weight. And during 45 degrees of flexion, it is about 3 times the body weight. During 75 degree of flexion, it is about 6 times of the body weight. Yeah, it is nothing but the vertical position of patella. So we're going to discuss about the insole salvati index, which is very important. Normally, the ratio of patellar tendon to the length of the patella is 1:1. So in case of any variations in that, it results in patella alta. When the position of patella is a little bit high, it is said to be as patella alta. When the position of patella is a little bit lower, it is said to be as patellar baja. So we have discussed this before, that is the Q angle. So the normal Q angle is 10 to 15 degree here. So when it is more than 20 degree, it's called pathological. So what could be the causes of increased Q angle is tight IT band, genu valgum, femoral anteversion, imbalance between the vastus medialis muscle and the vastus lateralis muscle, lateral tibial torsion, the laxity of medial retinaculum, tight lateral retinaculum, prolonged pronation of the foot. Yeah, this is nothing but the picture representation of external, that is flexion torque in the closed kinematic chain. Yeah, coming to the causes of knee pain, it could be because of osteoarthritis, ligament injuries, meniscal tear, bursitis, plica syndrome, fat pad syndrome, patellar tendinitis, hamstring strain, IT band friction syndrome, patellofemoral pain syndrome, etc. Yeah, these are the references I've been took. Thank you.